Hello, my name is Veronica Lee, and I am an MPhil student studying public policy at the Hong Kong University of Science and Technology. Today I will be presenting Submission 49, under the title, Increasing Resilience Toward COVID-19 via Risk Mapping, Challenges and Opportunities for Stakeholder Empowerment in Hong Kong. As we all know, COVID-19 is a rapidly evolving pandemic that has caused unforeseen consequences, with 16.5 million confirmed cases and over 650,000 deaths as of July 30th, 2020. In Hong Kong, a city that is usually known for its economic prosperity, GDP has fallen by 9% within the second quarter of 2020, and the unemployment rate is at 6.2%, the highest it has been in 15 years. More than ever, there is a need for accurate, real-time data to inform governments and citizens around the world to make careful policy decisions, especially surrounding public health. One of the solutions that has gained considerable traction this year has been the creation of Geographic Information System, or GIS, dashboards. By displaying the spatio-temporal data of COVID-19 on an interactive map, people can easily identify where cases are, which areas are high risk, and which places they should avoid. Because these dashboards are so widely used, we wanted to understand how citizens interacted with these dashboards, and whether the dashboards affect their behaviors and decisions at all. Using dashboards as a reference point, we posed the question, what are the opportunities for citizen engagement for data-based COVID-19 solutions in Hong Kong? As literature suggests, citizen engagement has proven effective in past epidemics. For example, individuals in China were able to inform their communities about SARS using SMS and the internet. This indirectly pushed the Chinese government to adopt a transparent approach to reporting on SARS. Also, Liberia used salient policies such as information provision, consultations with communities, and community-based surveillance teams to increase resilience toward Ebola. More recently, Hong Kong citizens mobilized to disseminate information via social media and mass-produce face masks to protect the community from COVID-19. Based on these examples, the benefits of citizen and community engagement include the creation of salient policies, the encouragement of transparency and accountability, and increased capacity to deal with policy issues. In light of all of this research, we believe that it would be valuable to see if the use of innovative technologies, specifically COVID-19 dashboards, could bring about opportunities for citizen engagement in Hong Kong that not only increase community resilience, but re-establish social capital at a time of crisis. Therefore, we designed a survey of mostly multiple-choice, Likert-type questions to understand the opinions of dashboard users in Hong Kong. The data was analyzed first in Qualtrics, the system we used to create the survey, and further analysis was conducted in Stata. We shared the survey via several channels, including email, social media, and sharing by the dashboard developers to the users on our behalf. As of July 30th, we have received 361 responses, or 240 valid responses after filtering out incomplete responses. Semi-structured phone interviews were then used as a follow-up to gain an in-depth understanding of the underlying logic behind the survey responses. A total of 15 interviews were conducted in English or Cantonese, depending on the interviewee's preference. 11 of the interviewees were dashboard users, whereas another 4 were representatives of the dashboard's development teams. Here are the results of our study. Firstly, about half of our survey respondents most often use news and social media to access information on COVID-19. Dashboards are used less frequently, with almost half of the 361 survey respondents not using dashboards at all. Out of the survey respondents who did not use dashboards, nearly 2/3 shared that other sources already provide enough information to them. Among these respondents, news sources seem to be their primary source of information, although some people also used email and even the radio for COVID-19 information. Meanwhile, out of the 240 survey respondents who did use dashboards, 149 of them used COVID-19 in HK, which is a dashboard developed by the citizen group Team Vote4.HK. 133 respondents used the official government dashboard by the Center for Health Protection. 67 respondents used both dashboards. We are unaware of any other dashboards that are designed exclusively for monitoring COVID-19 in Hong Kong. Moving on, we asked our survey respondents what actions they took to protect themselves from COVID-19 after visiting the dashboards. Most people use masks and hand sanitizers, but based on the interviews, people do this simply because this is good practice, not because of the dashboards themselves. In addition, over 85% of respondents shared that they used the dashboards to identify and avoid crowded and high-risk areas. 65% of the people said that they would stay home. Some would stay home if nearby areas had COVID-19 cases, while others stayed home regardless, making the dashboard not as useful to them. As for the actions the users took to protect others from COVID-19, over 93% of the respondents said that they would use masks, indicating that they recognize the importance of masks not only for protecting themselves, but protecting the people around them as well. Over 2/3 of the users avoided hosting or attending gatherings, and a similar number of people would share information with their colleagues and loved ones. Some interviewees clarified that they used the dashboard to make collective decisions on whether or not to work from home or to go out in general. We also asked the survey respondents about how they selected the dashboards they used. About 95% of respondents indicated that accuracy and trustworthiness are the most important factors in choosing a dashboard. We will discuss the importance of trustworthiness later. During the interviews, when we asked users why they considered accuracy to be the most important factor in selecting a dashboard, most of the interviewees noted that inaccurate data would lead them to incorrectly estimate the risk of visiting any location. As a result, they would make an incorrect decision, placing themselves at higher risk of contracting COVID-19. Therefore, it does not matter to them who provided the data, as long as the data on the dashboard is accurate. In comparison, factors including political considerations and neutrality were only secondary to accuracy and trustworthiness. In the case of neutrality, interviewees noted that accurate data would be politically neutral anyway. As for political considerations, over half of the survey respondents thought of this factor as moderately or even less important. One reason behind this result is that, according to the interviewees, people are willing to use dashboards created by a party with a different political ideology, as long as the politics did not affect the accuracy of the data presented. Instead, the degree of politicization mattered more than the political stance itself. Excessive politicization may even deter individuals completely from using the dashboard, because accuracy matters above all else. Even if the developer of a dashboard shared a similar political stance to the users are simply looking for facts, so they will critically assess any source they come across and dismiss comments they consider as biased. The implication of this is that even a user who tends not to trust the government in any other context would trust that the government is providing accurate COVID-19 data. Therefore, such a user would be willing to use and trust the government dashboard. This is remarkable because it suggests that Hong Kong citizens believe that the Hong Kong government's data on COVID-19 is objective and not tainted by politics. This is not a trivial result, as this is not always true in other jurisdictions. For instance, as one interviewee pointed out, the counting and classification of COVID-19 cases has become a point of political contestation in the United States, and it has led to further erosion of public trust in the US government at different levels. Because trust is such an important factor, we also wanted to see if the same level of trust was present if the users were to provide personal information to both dashboards. As it turns out, about 80% of survey respondents were generally hesitant to provide data to both dashboards. More survey respondents were completely unwilling to provide data to the government dashboard in comparison to the citizen dashboard. Indeed, when breaking down the responses based on whether users are comfortable with the government accessing their data, the distribution of responses changes drastically. Looking at the respondents who do not want the government to access their data, over 2/3 of them are either completely or mostly unwilling to provide data to the government dashboard, but they may be more willing to provide data to the citizen dashboard. The results are the opposite when we focus on the respondents who are more comfortable with the government accessing their data. In this case, users are more willing to provide data to the government dashboard than to the citizen dashboard. Therefore, there are two types of trust that affect citizens' willingness to share data with the government: political trust and trust in an organization's capability to protect user data. The interviews were able to shed more light on why trust was a key factor in the willingness to provide data. Some users trust that the government would be able to more securely store their data. They also believe that the government would be less likely to misuse their data, either because of potential legal ramifications or because the government has the responsibility to protect the data of citizens. A citizen group, meanwhile, may not have the same responsibilities or intentions. On the other hand, there were two interviewees who trusted the government less with their data. One of the two interviewees would be more comfortable with providing data if the government specifically stated how the data would be used, since they felt they would be legally protected if the government misused their data. The other interviewee did not want to share data with the government unless absolutely necessary, because they no longer trusted the government following the events of last year's protests. Lastly, there was one interviewee who presented more nuance to the situation by stating that he trusts some governments, including the Hong Kong government, more than other governments in their handling of data. In addition, we found out that users' willingness to provide data was not only dependent on trust, but on the type of data that was demanded as well. Most of the survey respondents were willing to provide health and location data, but some interviewees clarified that they would only share this data if they were diagnosed with COVID-19. The reason is, if they were a COVID-19 patient, they felt that it was their duty to society to disclose such information, whereas they had no reason to provide the same data if they were healthy. Meanwhile, 5% or fewer respondents were willing to disclose their names or their family information. One interviewee pointed out that he has no right to provide information on his family without their consent. 30 respondents, or 1/8 of the respondents, were completely unwilling to disclose any personal information. The willingness to provide information seemed to increase noticeably when the information was not personal. Over half of the respondents were willing to provide data on their relevant personal experiences, as well as the people they had close contact with. This suggests some new approaches the Hong Kong government could potentially use during Hong Kong's third wave of cases, including anonymous contact tracing applications or crowdsourced platforms for sharing personal experiences related to COVID-19. For both personal and less personal data, the common point seems to be that people are willing to provide data as long as it is anonymous or de-identified. One interviewee also specified that he is uncomfortable with sharing specific information on his medical conditions, as he is worried that, were he to contract COVID-19, people might connect his symptoms to his medical conditions or bad habits and criticize him as a result. However, in general, based on the interviews, the data that dashboard users actively search for appears to align with the information they are willing to provide. For example, several interviewees who would only be comfortable with sharing location and health data believed that disclosing details such as the age, sex, and profession of each patient was excessive. Another interviewee was willing to share their age, since they believed that it was helpful to see if mortality rates were higher among different age groups. The fact that users' demand and supply for data would mostly be congruent is reassuring, as it means it would be rare for a user to refuse to provide the data that they expect from everyone else. One factor that appears to shape users' data privacy concerns is culture. Specifically, the interviewees who seemed more concerned about re-identification risks and data privacy had previously lived in Western countries. A memorable quote from one interviewee was, "In Canada, I cannot imagine them identifying 55-year-old male who lives on the street. Not even the house number or their apartment building number, but on the street or on this neighborhood. I'm not sure that everyone in Hong Kong needs to know the age and gender of every patient or the building that they're in." In contrast, two dashboard users that were from Hong Kong and India were interested in understanding the COVID-19 cases in more detail, whether it is the patient's health conditions or their age and sex. With such a narrow pool of interviewees, it may be premature to make such a generalizing conclusion, but this conclusion seems to be supported by other studies. This includes an entire special issue of ethics and information technology on how culture influences perceptions of privacy and data privacy. Now, some of the main reasons behind people's data privacy concerns are summarized in this slide. The most popular answers were that users wanted to protect their own data privacy, and they were worried about their personal data being leaked. Over half of the survey respondents also wished to protect the privacy of others. A similar number of respondents did not want the government to access their data. Although some of the survey respondents chose this option because of political reasons, other respondents shared that they would be skeptical simply because the government already has so much data on hand. Far fewer respondents were concerned about stigmatization, and almost none of the respondents answered the question with none of the above. We also asked if there were any factors that would make dashboard users more willing to share information, but they seemed more hesitant based on their replies. About 63% of respondents would be reassured if the data were deleted after a certain period of time, and about half of the respondents again preferred not to have their data collected by the government. It was also interesting to note that more respondents replied with other or none of the above in this case. The additional factors that could make dashboard users more comfortable with sharing personal data can be divided into two categories. One is data privacy, use, and security. This encompasses conditions such as using data only for specified purposes, only collecting anonymous or de-identified data, and ensuring that the data collection system is highly secure. The other category is related to trust and politics. Some respondents have more trust in democratic political systems. Others trust the government to protect their data and use data for public welfare. And yet another respondent specified that they trust scientific or medical experts. At the end of the survey, we asked for the respondents' ages and education levels to see if these control variables affected the overall responses. We noticed that more than half of the respondents were under the age of 40, with 1/3 of the sample population consisting of 18 to 29-year-olds. This could be because some of the older respondents used traditional media instead of dashboards to receive updates on COVID-19, so they were filtered out of the study. We also noticed that the sample population is highly educated, with over 70% of the respondents having at least a bachelor's degree. Interestingly, half of the interviewees also had some degree of research experience. This could potentially explain the respondents' increased demand for data, as well as their pursuit of scientific knowledge and cold, hard facts. Perhaps most importantly, the fact that citizens are highly educated suggests that there is an abundance of knowledge capital in Hong Kong, and the government could consider finding ways to access that knowledge capital for improving their response to not only COVID-19, but other policy issues as well. In the last part of this presentation, I would like to discuss the differences among various dashboard developers in Hong Kong. This comparison includes the government and citizen dashboards mentioned earlier, as well as a third global dashboard called Coronavirus Dashboard. Firstly, all three dashboards had some degree of citizen involvement, especially at the design stage. The government conducted some form of user experience evaluation to change the layout and functions of its dashboard. Meanwhile, the Coronavirus Dashboard was created from scratch by 3 secondary school students, with some friends as occasional volunteers. COVID-19 and HK provided the most opportunities for citizen engagement. Citizens could sign up via a Google form to become a volunteer, with duties ranging from coding to information collection to translation. There is even a page dedicated to crowdsource information on dubious pharmacies that are suspected of selling overpriced masks or other faulty products. The dashboards also use different avenues to collect user feedback. The COVID-19 and HK Citizen Dashboard had the most straightforward feedback method, which was to embed a link on the website to a Google form. Meanwhile, the CHP Dashboard and Coronavirus Dashboard both welcome feedback via email. For the Coronavirus Dashboard, users can locate the email address at the very bottom of the web page. In contrast, feedback for the government dashboard is collected by the general email address for the CHP website, which is not mentioned at all on the dashboard itself. In the interviews with the dashboard users, several interviewees had stated that they had no idea there was even a way for them to provide feedback on the dashboard to the government. Both the degrees of citizen engagement and the feedback channels could be related to the responsiveness of the dashboards to feedback. Both of the citizen dashboards have been quite responsive, as they have made direct and noticeable changes to their websites based on the feedback they received. For example, a user of COVID-19 and HK noticed that the developers added a map to visualize the geographical distribution of cases after they requested for the feature. The government dashboard has also changed its design and functionality, but some users have still complained about certain aspects of the design. The slower responsiveness of the government could be partially attributed to the fact that the departments and bureaus that are responsible for the upkeep of the dashboard also have other pressing priorities. At the same time, perhaps the government could borrow from the model of the citizen dashboards by hiring citizens to respond to feedback. Another differentiating factor among the dashboards was how the information was fact-checked. This was not a concern for the government dashboard because the figures are official, and the health information is provided by medical professionals under the Center for Health Protection. However, for the citizen dashboards, fact-checking is a more pressing concern. The coronavirus dashboard also posts official government figures of COVID-19 cases, as well as news articles from sources they consider to be reputable. The COVID-19 and HK dashboard takes even more fact-checking measures. They collaborate with the Public Health Research Collaborative, or the HKPHRC, which is a research organization that primarily consists of former and current medical students in Hong Kong. By leveraging the public health knowledge of the HKPHRC, it was possible for COVID-19 and HK to fact-check and share accurate medical information about COVID-19. Finally, the three dashboard developers have made commitments to open data. The government now provides raw CSV files of recorded COVID-19 cases via the Open Data government website. And the same data is presented on the CHP dashboard. The two citizen dashboards have also made their COVID-19 data openly available on their websites, either as CSV files or as Google spreadsheets. Both developers commented that they wanted this data to be available, especially to researchers who wanted access to the data. The coronavirus dashboard developer even provided a spreadsheet of the website's user traffic to us upon request. Clearly, all three developers have made concrete actions to not only open their data, but also provide their data in a timely and convenient manner. In conclusion, the use of dashboards and other science-based resources has been successful in helping individuals in Hong Kong to make informed decisions during the COVID-19 pandemic. This is remarkable considering the city's tense political climate, and this success can be attributed to Hong Kong's trust in scientific knowledge and the perceived objectivity of COVID-19 data. The latter refers to the government's commitment to providing accurate COVID-19 data without politicization. At the same time, the Hong Kong government should implement additional measures to alleviate public concerns over data privacy and security. Examples of such measures could include hiring auditing organizations from around the world to conduct holistic assessments of policies involving the collection of sensitive data. The government could also establish transparent and legally binding cross-border data transfer agreements with mainland China. Lastly, the Hong Kong government should continue to use science-based data tools to inform the public on policy issues. To make sure this information is accessible to everyone, the government should make efforts to understand the perspectives of the most vulnerable subpopulations to COVID-19. This includes the elderly, lower-income households, and patients with pre-existing health conditions. Since some of these subpopulations may lack access to the knowledge that could protect them from the risks of COVID-19, it is important to reach out to them and understand how policies could be shaped to empower them during a health crisis. Thank you very much for listening.